So you're a patient here at Bet Shuva. What brought you here?
Well, I have a history of alcohol and drug abuse, for which I've been sober for about 9 months now. But what brought me here is gambling. I developed a gambling problem probably about the age of 20, and for the last 20 or so years, I've progressively gotten worse and worse. So I came here to help with my gambling.
What have been some of the consequences associated with your gambling?
For me, the consequences, it's pretty much destroyed every interest that I've ever had in life. It's destroyed my relationships with my family, with my partner. It's significantly hurt. And it's hurt me, obviously, financially, too. So.
What led you to coming to Bet Shuva in terms of how did you decide this was a good fit program for you?
Well, I found out about it online. I looked it up online. I think what brought me here is that I've always been somebody who always could find hope in every situation, and I pretty much got to the point where I couldn't find hope anymore, and that was really scary for me.
Ever suicidal?
No, I was not suicidal, but I just had gotten to that point where I could not find, I couldn't keep lying to myself and making excuses for what I was doing.
What was it like for you, your occupation, you're in a helping profession, but then also to find yourself needing to be healed? What was that discrepancy like for you?
You know, it was I think, if anything, it helped. You know, I'm a nurse, so I can kind of pull, you know, from my nursing background. But at the same time, when I decided to get help, I was so sick that, you know, I really didn't, you know, make that connection, I don't think.
What was gambling about for you? People talk about gambling, problematic gambling being, you know, for escape, excitement seeking, to cope with challenges, stress. What was it about for you?
For me, I think gambling was a way to not think about things that I needed to think about. I come from a history, a lot of my family is alcoholic. Both of my parents, or grandparents, died from alcoholism. My dad's an alcoholic, and my brother actually died from alcoholism at a relatively young age. So I think I was trying to not think about some things that I needed to think about. Also, low self-esteem. It gave me a feeling of false self-worth when I would gamble. I played poker there towards the end, and if I could see other people looking at me and, you know, in a tournament or so forth, looking at me like I was doing well, it kind of gave me a sense of worth, a sense of belonging. So.
Looking back, what would you say about that sense of worth? Was it a false sense of worth?
Definitely, yeah.
And what have you discovered here at Bet Shuva about your worth?
Well, I've started to learn a lot about self-worth. I've learned about establishing some values and having my behavior actually meet up with those values.
So more congruence in your life.
Exactly, which creates a sense of self-worth. So that's been really exciting for me.
Tell us more about the treatment here that you received. What do you feel has been helpful for you?
I think the number one thing that's been the most helpful for me is just a sense of community. It's coming here and meeting people from all different types of backgrounds, much different than mine in some cases, and just seeing that we're all the same. And being able to talk to people. I was very isolated in my disease, and to come here and to be able to talk to a lot of different people really made me feel, I guess, a best way of putting it is at home, you know.
Tell me about the staff here, the clinical providers. What's your experience been like with them?
Oh, it's been great. You know, I have a therapist that I work with, a psychiatrist, and then, of course, just the different counselors that we all deal with in the different groups. You know, it's been very, very supportive and very helpful. Yeah.
They have a spiritual component to the program here. Are you of the Jewish faith?
No, I'm not. I'm Episcopal.
So what was it like for you not being Jewish, being here? What's that been like?
Well, I guess the best way to put it's been a learning experience. I'd never really been exposed to the Jewish faith. It was difficult at first because I was sitting through services and didn't really kind of understand what was going on. But even in that, I kind of learned a lot. I learned to be patient, to sit in something that maybe you're not familiar with, and, you know, to learn that you can always pull, you know, from situations that you're not familiar with. So.
If someone else were considering coming here for treatment for gambling, you know, what would they need to know in order to decide if this program was a good fit for them?
You know, it took me 20 years to get to the point where I had to actually reach out for help. And along the way, I had plenty of people telling me, you know, you may have a problem. So I think that it has to be a decision that each individual makes. It's one of the hardest decisions I've ever had to make to come here. It was terrifying. But now that I've been here, it's the best decision I've ever made in my life. I feel at peace now. And like many other people say, they feel like they're getting their life back. And that's a great feeling.
You're a little bit different because you're coming here on an outpatient basis.
Right.
So you have time out in the community, and then you're here doing some treatment as an outpatient.
Right.
You feel like your experience here has given you the skills and the capacity to resist cravings or urges that come up for you in your life outside of here?
Definitely. I feel very lucky that I get to make that transition back into the real world, but at the same time be able to come back here on a day patient status. It allows me to test out the tools that I've picked up here.
And what have you found?
They work. It's great. It's great. I've learned many different tools. A lot of them, first of all, that I need to learn to reach out to people in the community, the Gamblers Anonymous community, get a sponsor. And so it's nice to be able to take some of these, go back into the real world, and put them in before I actually have to go back out there and not have this place to come back on a regular basis.
A lot of people suggest that people who gamble have a lot of irrational patterns of thinking. You know, what have they done here at this facility to help you reorganize your thinking about your thinking, if we could say it that way?
I think the most important thing that I've learned here about rehabilitation is the idea that this will be an ongoing process. Being a nurse, I kind of relate it to having diabetes, and you always have to make sure you're up with your treatment.
Monitor your blood glucose level.
Right. This isn't something that you fix and put up on a shelf. This is an ongoing process that I'll have to work on for the rest of my life. I didn't get that before.
There are some people out there that actually find the disease model of conceptualizing gambling as a little problematic. Do you think it's helpful to conceptualize it that way? Does somebody have to conceptualize it that way in order to get better?
As a disease process, for me, yes. Mm-hmm. For me, yes, definitely. I have to be able to accept the fact that I have a disease that I am completely, helpless to. So.
Talk about powerlessness, surrendering. I mean, those are concepts that are kind of part of the 12-step phenomenon. What's been your experience with those two things?
That was actually one of the best things that I came to realize in this process. I always had heard the idea that because of course I had a little bit of sober time with alcohol and drugs before I came in here, about 9 months or 8 months at that point. But I didn't really quite get the idea of completely surrendering. For whatever the reason, when I got in here, I fully grasped the idea that it's over, I've lost, there's no need to fight it anymore. And that was a huge thing for me. Because when you let go of all that, you're able to actually start working on getting better, I think. So that was really big for me.
Is there anything else that gamblers should know or others people should know just about gambling or the program here that you think would be helpful?
Yeah, I think, like I said, I think it's one of the most difficult decisions that you can make. When I first came here, I think within the first week I actually wanted to leave maybe 3 times. I didn't like it. I just had all these resistance to it. Mainly because you have to give up so much of your freedom and your control. And I think as addicts, we want to have that control in the real world in every aspect of our lives. And if I can't have it, I'm leaving the situation. It was absolutely essential for me to come here and to be under some type of stringent program where I had to lose all control like that and completely surrender to it.
You know, a lot of people find a residential program of any kind, a little bit disconcerting because it's so time-intensive, resource-intensive. It consumes a lot of our efforts and energy. Do you think an an inpatient residential program was what was needed for you? Do you think that there are people that could have gambling problems that could get better without having to be in a residential program?
I think so, yes. I mean, definitely some people can. For me, absolutely not. One of the things that actually led me to coming here was that my partner and I had the potential to lose our home, had gotten behind on payments.
Because of gambling?
Because of gambling, because I was, I was in charge of all the money and I was putting off the bills. So we got a letter actually letting us know that, and at that point I had to come clean with the whole situation. At that point I started to have big problems. I thought I was actually going to have to go to the hospital because of the level of anxiety that I was feeling. Fortunately, we were able to fix that situation. The next day, and this is just to kind of show you how my disease was working, the next day I had rationalized it all. I was fine. I was just going to go to GA meetings. I talked with my AA sponsor, my family, my partner, and they helped hit home the idea of how can you one day having to, potentially having to go to the hospital because you're just under so much stress and anxiety because of the situation that you've created. And the very next day, everything's fine. You can go to dinner, you can start going to GA meetings. So for me, it was, it's kind of tricky. The disease will trick you into thinking that you don't absolutely have to get the help that you need. But for me, it was, I don't think I could have done it without this place. I really don't.
And what gives you what gives you hope at this point moving forward?
Hope, just the level of peace that I feel right now. As silly as it sounds, this past weekend I went home and with some family and friends I went bowling. And I think that's the first time in, as far as I can remember, maybe 10, 15 years, where I was actually present at an event with family and friends and wasn't thinking about gambling, how much money I was going to bring the next time, the next tournament I was going to play in. And of course I didn't realize it till after, and that was just, like I said, as silly as it sounds, it was awesome. It was awesome to be able to experience actually being present with family and friends, hearing what they're saying and experiencing, the activity. So that's what gives me hope.
Thank you for your time and
You're very welcome.
your gift.
You're very welcome.